Rhinogram is the first telehealth and patient communication tool of its kind, which meets patients where they live and is designed around convenience and increased access to health services for patients everywhere. Rhinogram connects the most ubiquitous channels of communication patients use in everyday life right into the practice's account. For the patient, there aren't any bulky apps to download or login credentials to remember, and on the provider side, we offer all the tools and controls necessary to maintain HIPAA compliance. During this video, we'll walk you through a high-level overview of how Rhinogram works, the patient experience, as well as how practices can implement the solutions to drive value in the areas of patient acquisition, practice efficiency, and satisfaction. During setup, Rhinogram will take your main office phone lines, make them textable, and route them into your Rhinogram account. You'll be able to advertise anywhere your numbers are displayed that you accept real, two-way text. We'll also integrate your business's Facebook page so that anytime a prospective or existing patient visits and clicks Message Us, those messages flow right into Rhinogram, giving you the ability to continue the conversation in a compliant way. Finally, the Rhinogram web form can be added onto your website so that site visitors can easily submit questions along with their name and phone number to receive a text message back from your organization. Each of these channels of communication will be routed into your Rhinogram account into one or more configurable inboxes. You'll notice this practice has an inbox for reception, which takes general inquiries, one for clinical review, and billing. These inboxes are customized to the needs of your organization during the setup process and allow you to segment responsibility for follow-up and assign messages between groups.
Let's log into Rhinogram as a practice member now. Rhinogram is a browser-based solution, which means you'll access it from any internet-connected device. We also support native applications for Android and iOS. Usually, staff members will have a Rhinogram window pulled up side by side with their EHR throughout the day. It looks like we've got a new message in our reception inbox. Let's take a look. You'll know you have a new message in Rhinogram by seeing the badge count to the right of the inbox, or through push notifications each staff member can enable on his or her desktop or mobile device. When you open a new inbound message, you'll be able to see all of the demographic, appointment, balance, HIPAA consent status, and connected party information for that contact. This patient doesn't look like they've granted consent to use digital communication with this practice yet. So the first thing we'll want to do is access the customizable template library and select the HIPAA consent template. Once the patient responds, we'll update the consent status in their profile so anyone accessing this record can see the current status as indicated by the HIPAA badge to the right of the patient's name. The template library is fully customizable, and each staff member can select their favorite, most used templates to appear at the top of the list. The library allows your team to uniformly respond to patients' most commonly asked questions in a way that's quick and simple, and even automatically attach files and images to messages. Now, let's get back to the patient and follow up on their question. This patient is reaching out because they recently got an injection and are experiencing pain, redness, and swelling at the injection site. A reception team member can easily respond with a message template or craft a personalized response. We can even ask the patient to send us a picture of the area of discomfort so the issue can be triaged by a clinical team member. The patient has returned a picture of the injection site, so now we'll assign the conversation to the clinical review inbox so it can be triaged. When reviewing a picture, you'll be able to enlarge, rotate, or download images to appropriately assess and message with the patient to get additional information. The conversation can also be assigned to an individual person for follow-up, like the treating physician. The clinician reviewing the issue can choose to respond back to the patient personally or leave a private note on the record with their impression and assign it to another team member for follow-up. Once the interaction is completed and the issue resolved, a practice member can close out the conversation, which archives the contents in a permanent, uneditable communication health record. This information will always be preserved. Whether you're initiating a new message or you receive an inbound message from that same patient, every member of your team will always be able to see the complete, contextual history along with timestamps, event markers, and notes. In this example, we showed a patient with a clinical question, but practices can use Rhinogram to communicate about a myriad of topics like scheduling, lab and test results, directions to the office, patient paperwork, pre- and post-procedural care instructions, chronic care management, prescription refills, insurance, appointment reminders and confirmations, and more. Virtually every conversation you have with a patient by phone can be done via text message with a greater ability to quickly and conveniently reach your patients and their caregivers. Your team can respond to up to 5 text-based conversations in the time it takes to have one one-on-one phone call, which allows you to multiply your workforce and save valuable time every day. Let's take a look at some of the other capabilities Rhinogram has to offer. Out-of-office messages. Rhinogram offers 2 kinds of away messages. The first is an autoresponder placed on each of your channels of communication, which will automatically respond to an inbound message when your office is closed. This auto response will go out to each inbound messenger one time in any given off-hour period to let your patients know you've gotten their message and will respond during normal business hours. The second kind of auto response can be scheduled in advance and will override your normal business hours when your office has planned closures for work events and holidays. File exchange. As we mentioned before, Rhinogram supports the exchange of images between you and your patients, but you can also exchange PDF files for easy transfer of records, billing statements, and test results. Appointment manager and reminders. While Rhinogram is an excellent tool to have real-life conversations with your patients and their caregivers, we also offer automated text-based appointment reminders and confirmations. Based on your preferences, your patients can respond back to text reminders with codified responses that will automatically update your EHR schedule. You'll see free text responses to reminders as new conversations in your inbox, so you can follow up with the patients who have questions or would like to reschedule without asking them to call in. To manage your schedule, you'll have the Appointment Manager, which is a dashboard displaying all of your upcoming appointments with their status, where you can manually update statuses as needed. RhinoPay. Payment collection and invoicing can be time-consuming and costly for your practice. RhinoPay will help make collecting unpaid balances as easy as a click of a button. Just select the patient you'd like to collect a payment from, click Request Payment, and fill in the fields for amount and reason. Your patient will receive a text right to their phone with a link where they can enter credit card or ACH information. Long gone are the days of writing paper checks or creating cumbersome online profiles just to settle up on an outstanding copayment or procedure balance. Security. Risk management and compliance are important factors in deciding on a new software solution. That's why, in addition to data encryption, strict user authentication and password protection policies, and thorough training of all Rhinogram staff on the handling of EPHI, we also display an audit log of all activity in your account, which highlights any time a record is accessed or modified. To complement this, we give you scalable tools to define roles and permissions of each of your staff members, helping you restrict access for each user to the minimum necessary to perform the duties of their role. Team Chat. This tool is a secure, encrypted way for staff members to chat with one another, either directly or in groups. It's a great way to coordinate on a patient's care and improve front-to-back office communication. You'll never need to walk to another department or office. Simply use Team Chat to get immediate answers from your colleagues. Analytics Dashboard. You'll want a way to monitor all of your conversation activity in Rhinogram, and our Analytics Dashboard allows you to do just that. From average response time to measuring inbound contact counts, Rhinogram gives you all the insights you need to appropriately staff, understand your prospective patient activity, and coach and monitor your team. We'd love to have you join the Rhinogram herd. If you're ready to get started, text us at 423-800-7644, and a product expert will reach out to continue the conversation. Thanks for watching.